Welcome back to We Are Austin. An enlarged prostate is something that many, if not most men, will eventually deal with. And unfortunately, it can cause extreme discomfort. Dr. Michael Wynn is here from ARA with what you need to know about men's health, a very important issue. Good morning. It's great to see you.
Thank you so much.
Thanks for being here.
Appreciate
This is an
me.
important issue. Let's just kind of dive right in and talk a little bit about prostate enlargement and what's involved here.
Sure. So, prostate enlargement creates symptoms that are collectively called lower urinary tract symptoms.
Okay.
They're related to an enlarged prostate, which is typically a walnut-sized organ located at the base of the penis. We have a little picture here showing the prostate, the bladder's above it. The prostate surrounds the urethra, which is an opening, a tube, a channel that connects the bladder, connected to the bladder. It allows the bladder to empty. It also carries semen that's produced. Okay. So as that prostate enlarges, it squeezes the urethra. As you can imagine, that prevents flow out of the bladder and prevents urination by men very easily.
Yeah, absolutely.
So typically what happens is men have difficulty urinating. They'll have to sometimes strain to urinate. They might have hesitancy where they have to feel like their stream is stopping and going. Since they can't fully empty their bladder, they may have to go to the bathroom quite often. Some men talk about having to go to the bathroom 4 to 5 times during the day, another 4 to 5 times during the night.
Wow.
So they can't fully sleep,
Absolutely.
they don't get rested. Since the bladder is not fully empty, it does increase the chance for UTIs, a urinary tract infection. Sometimes they even have a little incontinence or dribbling because the bladder is so full.
Wow.
Obviously, that discomfort.
Yeah. And those are some quality of life issues for sure,
definitely reduces quality of life. It will occur in almost all men. 50% or more men over 60 will have symptoms.
Wow.
90% or more of men over 85 years will have symptoms as well.
That's a surprising statistic there. Right. So what are some of the typical ways of treating an enlarged prostate?
So patients can certainly start with simple lifestyle changes. They can decrease their consumption of fluid and liquids. They can decrease their consumption of alcohol or caffeine, which can stimulate urination, especially at night before they go to sleep. Unfortunately, that's typically not enough. They may progress to medications. There are some medications that help to relax the prostate. These are called alpha blockers. There are some medications that help to shrink the prostate a bit. Those are called 5-alpha reductase inhibitors. So those are effective. Again, sometimes patients progress despite those medications.
Oh, I see.
And that occurs, then there are certainly traditionally urological procedures or urological surgeries that can be performed. There's many of them, but the one I'm going to talk about real quick so patients know is traditionally there's a procedure called transurethral prostate resection that's performed. It's effective, but the way that's performed is it cores out a part of the prostate, and there are certain unfavorable side effects such as sexual dysfunction and urinary incontinence and bleeding.
I see.
So what I wanted to introduce was an alternative procedure, a minimally invasive option for patients.
Well, that's great,
Yeah, so this procedure is called prostate artery embolization. Again, it's a minimally invasive procedure. It has a relatively low side effect profile, lack of sexual dysfunction, lack of urinary incontinence. Some patients even describe improved sexual function afterwards.
Oh, wow.
Yeah.
Nice.
The way we perform the procedure is we make a tiny incision into either the groin. I think there was a slide showing the groin here.
You can see it right there.
Yeah, so here's this is the groin. There's a blood vessel of the groin. We can actually make a tiny incision about the width of my pinky or smaller into either the groin or even at the wrist potentially.
Fascinating.
And basically advance a catheter, which is a tiny tube, down to the vessels that supply the prostate.
Okay.
And so here's the prostate again. Here are the vessels that carry that blood supply to it. So once we actually get into those blood vessels that supply the prostate, we can infuse tiny little particles.
Oh, wow.
These particles basically block up the blood supply to the prostate. There's no severe detriment to the prostate, but what it does is it helps the prostate to shrink a bit in size and relieve the blockage. So here, both sides of the prostate, both sides of vessels of the prostate are embolized, and again, it helps the prostate to shrink a bit, help to relieve the pressure on the urethra, and therefore patients can urinate more freely.
Oh, I bet that's a relief,
It's a very, very effective. Keep in mind that this procedure, while slowly being adopted in the U.S., has been performed for 10 years or more outside the U.S., has been very effective. Literature has shown it to be 90% effective or more when technically successful.
Wow.
So it's a great option. What I really want to do is just make sure patients are aware of it.
Yes.
We definitely want to work in conjunction with their urologist to figure out what's the best procedure or option. It may be prostate artery embolization. It may be a urological surgery, but I just want them to know that there's definitely other options.
I think that's really important, and I think that's what you all do very, very well at ARA. So this is an option right here. There is a special line, actually, that they can call if they have issues, prostate issues, and they're wanting to know a little bit more, correct?
Right. We have direct line to our clinical team there, the interventional radiology team. They can certainly give that a call directly and get a hold of us. We'll certainly work with them. They can also be referred through their primary doctor or their urologist. Again, our goal is to work in conjunction with those other doctors and figure out what's best for them.
Well, it seems like a really great option, and I'm really happy to have you here today to let our audience know that there are options out there. Thank you very much, Doctor, for joining us. We appreciate it. All right, check them out at AOSRAD.com to check out more about this wonderful procedure.